Hello, my name is Jordan Stefko, and I'm here to talk about our upcoming paper in the Journal of Developmental and Behavioral Pediatrics. This paper focuses on screening for children's chronic health conditions and their strengths and difficulties in primary care. Psychosocial factors are important and affect the quality of life for children with chronic health conditions. There are many documented adverse outcomes for children with undiagnosed behavioral and developmental conditions. The primary care clinician has an important role in identification and management of children with behavioral and developmental conditions. The objective of this paper was to explore parents' perceptions of their child's health status as well as their child's strengths and difficulties using two validated instruments in primary care settings. We examined this association with the Children with Special Healthcare Needs Screener and the Strengths and Difficulties Questionnaire in primary care settings. There is a lack of research using these questionnaires in primary care practice. This was a cross-sectional study which included a sample of 970 English-speaking parents of children aged 2 years to 17 years. Questionnaires were completed in primary care offices within the Southwest Ohio Ambulatory Research Network, which includes urban and suburban pediatric offices and a federally qualified health center. The study was collected as a convenience sample. The Children with Special Healthcare Needs Screener is a screening tool that was designed to reflect the United States Maternal and Child Health Bureau definition of children with special healthcare needs. The survey was completed by parents, and 3 subgroups were created based on parents' survey responses. These include children with no chronic health conditions, children with chronic health condition with no functional limitations, and children with functional limitations. The Strengths and Difficulties Questionnaire is a 25-item behavioral screening questionnaire. It assesses 5 factors: emotional symptoms, conduct problems, hyperactivity, peer problems, and prosocial behavior. Each individual factor score ranges from 0 to 10. Total SDQ scores are determined by adding the scores on the 4 negative subscales. When comparing SDQ factor scores by children with special healthcare needs screener subgroups, we found that children with special healthcare needs compared to children with no special healthcare needs had higher scores in emotional problems, conduct problems, hyperactivity, peer problems, and impact score. We also found that children with functional limitations had scores that were higher than children with no functional limitations. For mean total SDQ scores, we found that mean total score for children with functional limitations was 7.52 points higher than mean total score for children with no special healthcare needs. Higher mean total SDQ scores were also observed for male children, children of unmarried parents, household income less than $50,000, parent education less than 16 years, and parent health rated as fair or poor. In our research, we found that behavioral and developmental health conditions are common and adversely affect children and their families. We also found that validated screening instruments used in this study aid the primary care clinician in early identification of children and families who may benefit from behavioral and developmental health resources.